But we'll move on to talk a little bit about our presenter, which we're so glad to have Shar Ronio joining us today. Before I give her full bio, I just wanted to mention that she doesn't have any conflicts of interest to disclose at this time related to this presentation. But let's get into introducing her. She's going to give a presentation on her work in Washington and Oregon as someone who works on coalitions every day. So, Shar Ronio serves as the Associate Director of State Partnerships at the American Cancer Society, where she leads efforts across Washington and Oregon. Shar collaborates closely with state cancer coalitions, cancer task forces, tribal nations, and health plans to advance comprehensive cancer control initiatives. And so, can't think of a better person to talk about that from that bio. So, I'll let Shar take it away and talk about her work.
Thank you, Aubrey. I first want to let everyone know I'm having internet issues, so I'm going to go off camera just so I don't freeze in the middle of the presentation. But I'm still here and I will be talking. So, um, as mentioned, I'm very pleased to be here to join everybody today to talk about our work around colorectal cancer. As mentioned, I'm Shar Ronio. I am state partnerships overseeing and work heavily in the states of Washington and Oregon. Next slide, please. Um, so I just wanted to give a little bit of background about my state. And I will say that I actually live in Washington State, but work in Oregon and have lived in Oregon before. So I'm very familiar. A little bit about our state. We're in the northwest corner of the country. If you don't know, Canada is to our north and the Pacific Ocean is to our west. We're divided into basically two regions, and we're divided by the Cascade Mountain Range. And our two regions are very, very different. We have different climates in those populations. Our density is different. Geography is different. And if you're looking at the map and not familiar with our state, the little blue star represents where Seattle is located. Actually, not quite in the middle of the water there, but in King County. Um, you will notice that Eastern Washington, the eastern side of our state, is predominantly, well, you can't tell, but it's agricultural. And a couple of the pictures that I have throughout the slideshow will show that. In those agricultural areas of where our rural communities are mostly located, and they're represented by the green and yellow. Those rural communities are typically the communities that we have the lowest the lowest screening rates, but the highest cancer incidence and mortality across the state. And I just want to give a little bit of background. Um, since I work in Washington, but also in Oregon, in 2003, we brought our colorectal cancer coalition together and formed the Northwest Colorectal Task Force. Washington and Oregon have very, very similar geography, populations, particularly our racial breakdowns, and our CRC rates are within a half a point of each other. So we came together collectively and said, instead of working on screening and education, we wanted to do it as the two states working together. So I will show you one highlight from the state of Oregon. Next slide, please. So today I'll be talking about three different projects that we did within the two states around colorectal cancer. The first example I'll give will be our presentation by a presentation that was done at the Colorectal Task Force where we were focusing on screening and outreach in our rural communities. And all of these examples, we leaned into utilizing the data dashboard in the work we were doing. Our second presentation, my second example will be how the dashboard aids the work in the community outreach and engagement team through the uh, Night Cancer Institute of Oregon, and they're connected through the Oregon Health Science University. They are the NCI in Oregon State. My third example will be a project that we did in March of 2025 that we called Colon at the Capitol, where our ACS CAN, which is our advocacy side of ACS, and myself, patient support, came together and partnered with our Seattle NCI community engagement team and advocacy to educate our state legislators. Next slide, please. So the first example that I mentioned was in our task force meetings, we bring in speakers to talk about what they're doing around CRC, what's been successful, what hasn't been. In our May presentation, we were focused on work that's being done in our rural communities and particularly focusing on what barriers they were encountering. One of our presenters that day was Dr. Stephanie Hansen, who's an internal medicine physician who works with the Yakima Farm Workers Clinic, and they serve the Hispanic and Latino community members in a very rural part of Washington. When she was putting together her presentation, I had sent her the data dashboard because she was asking me about the rates in her county, which is Yakima County, you'll see on the slide. She shared the dashboard and the data that she had collected from it to kind of set up the basis for what she's doing within her area. And you can see that she had a 7% increase in their screenings within her clinic over what the county is doing. Next slide, please. The second example I have is the work that is the data dashboard was utilized in our CRC task force. When the dashboard first came out, we asked the National CRC Roundtable to present at our meeting about the dashboard and how to utilize it so all members were aware of it. As mentioned, OHSU Night Cancer Institute in Oregon, the NCI there, provides educational services across the state. And they do that through their mobile outreach van, which you see here. Derek Zembrowski, who is the community outreach educator, he's part of our leadership on our task force, and he says that when he is working on locations that they're reaching into, he utilizes the dashboard to look at what CRC rates are, both screening, incident, and mortality within those areas to help drive education conversations with community members around prevention and the importance of screening. Next slide, please. So my last example is with our, which happened, a project which happened during the National CRC Awareness Month in March. As I mentioned, our ACS CAN, which is our advocacy arm of ACS, and myself met and brought together our Washington NCI, which is Fred Hutchinson Cancer Institute, to put together an event that we called Colon at the Capitol. Prior to the event, ACS Can and myself developed a CRC impact report. It was a one-page information page that listed every county in the state. Each county had their own page. And you can see specifically, I have two listed here. Information was listed on for the counties from the database, specifically identifying the screening rates, incident and mortalities within those counties. The day of the event, we were at the state capitol. Our legislators were in session. They were invited to come to our presentation. The NCI had their inflatable colon there that we invited the legislators to walk through, gave them information about what CRC is, why it's important to get screening, what goes on with screening. As they then exited the colon, our advocacy took over, and they spoke to the legislators and gave them a sheet for whatever county they were representing or their constituents are in, and talked about what specifically their constituents were seeing as far as screening rates and their incident and mortality, really focusing on the importance of getting those screenings and making sure that we continue to have um, funding for our screening within the state. This was an incredibly impactful piece, and legislators really gravitated towards the information for their own constituents. Last slide, please. So I just wanted to, again, kind of very quickly go through three of our projects that we use the data dashboard for. I find it very helpful, and it kind of lays the groundwork and also provides the validity of why we are doing a screening, or we're talking about prevention in our areas. And I have to thank our team for inviting me, and I'll open us up for any questions.
Yeah, thank you so much, Shar. This was a great overview. I'm sure a lot of you are hearing from Shar as thinking even how can you use the data dashboard? And the great news is we're going to do kind of a large group tutorial after this. So know that if you ask any specific questions about the CRC data dashboard, we're gonna talk through some examples and get some feedback from you all and target the exploration of the dashboard to what you all want to look at. So, with that being said, great overview, Shar, and like such a great to thinking about how you can partner on specific projects and then inform with data. So, thank you so much. Really excited to see if anybody else has any questions. So feel free as we're starting to talk through some of these questions to put them in the chat box or put them in the Q&A box at the bottom of your screen. But I have just a few questions that I prepared for this conversation, which is, uh, did you need to convince your partners to work on colorectal cancer specifically? It seems like they kind of came to you, or was there kind of a back and forth? And if you did need to convince them, how did you go about doing that?
I didn't particularly need to convince them to do CRC screening, but part of it was as partners came together and as we worked together, we were able to show the importance of the screenings because of the data, mostly to upper management, why they need to be focused on this particular thing. And um, with the data, we're able to show, look, we are making progression with screening rates in our counties. And also why we're focusing in our rural communities, because those are the areas where we're seeing the most individuals that are not getting screened, but we're also seeing later stage cancer rates, and our mortality rates are higher typically in our more rural communities.
Yeah, absolutely. Which, if any of you haven't seen, the Colorectal Cancer Roundtable just released a rural guidebook to help target some of the people in rural areas. So, I'm sure we can share that after the presentation in a list of resources as well. And I know we have it in the list of resources for this presentation because when we get into the tutorial, you'll kind of see that it's often you're seeing those low screening rates, high mortality, high incidence sometimes in those rural areas.
And
Yeah.
I
Oh, go
just
ahead.
want to add that we don't just use it in the rural communities. In
Hmm.
Washington State, Seattle is our largest area of population, but we have two counties above and below us. The next county right above is an agricultural community, and it is on our side of the state, but we see very high uh, incidence of cancer in those areas because people are not getting screened. So it's allowing us to look even within our metro areas. There are pockets where we can see that people are not getting screened, and we really need to focus with those individuals to be able to provide trusted information and provide data that shows this is why we need to be getting screened, and we can reduce the potential of cancer later or finding a late stage cancer.
Yeah, absolutely. Yeah, there's when we go into the dashboard, you can see some of it is by county, but some of it goes down to census tract. So
Mhm.
it's really useful in that sense and very useful for the ACS can work you did as well to show some of those legislators what's going on in their districts. Thank you for adding that. A next question is what was the biggest challenge you found while doing this work in the community or with your partners? What would you say that was?
Oh, that's kind of a loaded question. Um, I I would say the biggest thing right now, and that's what we were discussing at our last task force meeting, is just the trust that the partners are encountering with the people that they need to be doing screening with.
Mm,
There's a trust factor, both because of federal issues, but also just culturally. Like some cultures just do not do screenings, and the importance of us being able to educate around that, and the importance that we found through looking at this is also listening to what the constituents, what the patients are saying to us, and why they aren't getting screening. Some say that they're just scared to death of um, finding out about cancer. So we need to address from that issue. And we always call it the poop factor. They don't like discussing anything around that and how we can break that down. So the data has allowed us to look, but then once we look at the data and if there are pockets of individual communities, then we can look a little bit further into okay, is there a reason why they're not getting screened? Can we bring in partners that are that would be impactful? I'll tell you one project we did quite a while back, but reaching into the metro area to our Hispanic, Latinx, um, our Latino men who are not getting CRC screened, and the partner that we went to was the Catholic Church and their priests and their nurse practitioners that are within the church, because that's a very trusted source. And we were able to come alongside them to provide that. So it's allowed us to look at that. But sometimes, once we get the data, we also need to look okay, with that group, then what are some of the barriers we're running into? I hope that
yeah.
answered your question.
Oh, no, it absolutely did. And I think that's such a good point that, kind of like the next level is like you look at the data, but then you look at who you're partnering with. Like, are you partnering with the right people? Are you able to reach that population and also we always want to tailor our messaging to the population that we're trying to reach. And so having the buy-in of a group that works with that population, is part of that population, is just so important to coalition work. So it's a great point to make as well. Um, I believe we got a question in the chat, and that is, are you able to use the application of the dashboard to understand the impact and utility, which I think I can answer a little bit about because basically the dashboard is updated automatically. And when there is new data available, that is what goes into the dashboard, which we'll look at a little bit when we go through the tutorial. But is there anything that you want to add to that, Shar, about like the work you've done, if the data has updated and you've seen any changes in that or anything like that?
Not specifically, because it actually is a fairly new dashboard.
Hmm.
And that data is coming. I think right now what we're trying to do is just focus on where are we seeing the gaps at and where can we work with those gaps. Like the example I showed with the clinic in Eastern Washington, she was able to take that and then look at the clinic data and compare her own clinic data to where she stood in the county data. So that was really good to see. And that's a positive piece to give to um, all of the people working in the clinic. Sometimes when you're working in the clinic and you're doing the work, it's hard to see if you're actually making progress.
Yeah.
But she was able to take that back to the staff and say, look, we are making great progress. We don't want to back off of doing the screenings and keeping that forefront for our patients.
Yeah, that's a really good point. It's always good to get some good news. I feel like we're not always getting so many things that we feel good about, and so that's a really good point as well. And within that, like you might have a better screening rate in your community, but maybe there's a gap for Latino men, as you said, or something like that. So there's lots you can learn from the dashboard for sure. I think we have time for one last question, and it's kind of the opposite of the question I asked two ago, which is, what are you most proud of regarding the work that you've been doing with the dashboard and with your partners in the Northwest Task Force?
Um, the one I'm most excited about right now is the work that we did with our legislators.
Mhm.
Washington State had a budget a downfall,
Mm.
and they were looking at cutting a lot of our funding. And combining work with our advocacy side, I can't do advocacy, but partnering with our advocacy groups, we can get the word out because we need to make sure that the dollars are still there for us to do the screening work in the state, and like our breast and cervical and CRC programs, make sure that those are still funded. I'm very excited about it. The fact that we brought in our NCI, their education engagement group, their advocacy was there. Along with that, we put it out and we had survivors show up at the Capitol to talk to legislators about the importance of them knowing what's going on within their districts with their constituents. We had other CRC groups that showed up that day that wanted to be there to support the work. And I'm really excited about that because the group itself said we want to make sure that we do this next year because we think it's important that legislators hear it and that they understand that this is their constituents, but it's also their family members.
Yeah.
And are their family members getting screened and the importance of it? And we had several of the legislators come up and go, I was supposed to get my screening, my CRC screening, and I haven't done it yet, and I'm going to go get it set up right now. And we're like, do it now, because by time legislation is done, you'll have an appointment. But right now, we're kind of backlogged on appointments. So there was a lot of great conversation, and the fact that we're going to build on that coming this in our next legislation.
Yeah, that's so great, Shar. And thank you so much for providing your expertise and talking a little bit about the work that you've been doing. I see some claps. I know I've seen some hearts as you've been talking as well. And we just really appreciate you sharing with us. And the good news is we're going to move on from Q&A, but I'm sure that we'll provide some information afterwards with the recording that you all will be able to see the slides and everything like that. But we'll pull up the slides again just so that we can go through a few things before we get into our tutorial, which will basically show you how Shar did some of the work that she did. So hopefully you'll come away feeling like you have some understanding of the tool and are able to use it as you see fit. But the CRC data dashboard is something that the National Colorectal Cancer Roundtable partnered with the American Cancer Society's geospatial data team. And you'll hear someone from that team do a little tutorial in the next slide. But basically, it's interactive. It's a map that you can use to your own advantage, which is exactly what Shar did. And so you'll be able to see CRC surveillance data, screening rates, healthcare settings, like what is actually available, what is accessible to people, demographics, as well as additional health measures. So we'll get into that in a moment. But we'll go to the next slide, and we have a short video. It's about 4 minutes long. It covers really high level how to use it, and then we're going to actually get into the dashboard and get to use it, as well as get a little feedback from you on what we should explore. So go ahead, Disa, and press play.
This will be a quick review of the colorectal cancer dashboard. First, we're going to have a quick review of the different sections in the dashboard. The two obvious ones, of course, are the two maps. What's really nice about those two maps is that they are in complete sync. You move one, the other one moves with you. You zoom in, the other one zooms in with you. So it's very easy to look at a very specific location, for example, a state or a specific county, and immediately identify and compare between the two maps to different variables. Each and every map has the exact same layers, but you can choose which one you want to look at. Let's take a look at this specific icon that is all the layers. Next to it, there is the legend. The legend can be very useful, especially when you're not sure what you're looking at, and also to identify the different thresholds that make up the colors that you see on the map or the sizes. So, for example, in this case, on the left map, we look at Commission of Cancer Hospitals. And we also see the different shades of purple that represent mortality rates of colorectal cancer. On the right map, what we look at is screening rates from the CDC Places Project and NCI cancer centers that are shown in different colors based on the type of the hospital. You can change the layers that you're looking at. For example, you can simply toggle on and off a specific layer. So if I'm going to zoom out again a little bit to see the entire country, I can basically remove all the NCI locations and look at FQACs from HRSA. If I am not interested in looking at screening anymore, I can choose from all the other different layers that are available. For example, you have mortality, just as in the left map. We have incidence. We have screening, smoking, and obesity from the CDC. We have census data, such as the different age groups. All the census data was curated by the ESRI demographics team. We have educational attainment. We have race, ethnicity, and poverty. But for example, if I would like not to look at screening, but rather at smoking on the map on the right, and I would like to look at incidence and not mortality on my map on the left, that is how I do that, okay? So I can go to a specific state, such as just moving around the map, right? And looking at a specific location. Another way of doing that is actually going to the state selector on the top right and saying, okay, let's select now the state of Georgia, What's going to happen now are a few things. One is the maps are going to zoom to that specific state. It's going to filter only data for that specific state, okay? And then you will see that the graphs at the bottom, we have two graphs. We have mortality and incidence. Those are going to be filtered and sorted, right, by the rates only to those specific counties within the state of Georgia. Another section that is available to you are those three different lists. You see mortality, you see incidence, and then you see screening, and you can move between them. So if you're looking for a specific county, for example, Fulton County in the state of Georgia, it's really easy to go ahead and just look at that specific county, either by looking at the entire list or just by writing and searching for that specific county. You can always go back either by hitting the reset or just unchecking that specific state again, and then the map is going to be updated and basically going back to the entire country. Another section to pay attention to is that collapsibles section that is all the information.
You can go ahead and pause it. But so there's a whole extra section to this video that we will share with you that you can start to go through that are more like helpful tips and tricks. But that gives a really basic overview of how to use the dashboard. And so we are going to share that link in the chat for the video, which also contains the link for access to the CRC data dashboard that Shar used in her work that you could potentially use in your work. And we're going to go through a couple of these questions on the screen as examples and get some of your feedback on which states we should explore and actually get into it. So, what we encourage you to follow along by following those links, opening it up, starting to explore, or by watching me, depending on if you have two screens like I do, it's a little bit easier because I'll be talking to you all over here while looking at my screen and showing you what I'm doing. But we'll get into some of these questions now. So I'm going to go ahead and share my screen. So if you followed that link, you will see to click to explore the data dashboard at the top of that page. And then you will end up on this type of screen where this should be what you're seeing. And this is usually how the data dashboard shows up as is. And so when you're looking at the data dashboard, you'll want to start off by just saying like, okay, where am I? What am I doing? And you'll see my cursor going around and you'll see this little legend here, which is always useful to see what you're actually looking at. So what it's showing is cancer centers and it's showing mortality rates. So as we go through this, we're going to keep mortality over here. So these are the same maps currently. And we're also going to add in over here instead of mortality, we're going to add in incidence. So this is only colorectal. So just keeping that in mind. I like to think of the layers, they kind of look like cheese slices to me. And so over there at the cheese slices, the layers, you'll go on down and find those rates. And you can see that this is showing the rates. It's got the little eyeball instead of the crossed out eyeball. And we open that up, we see mortality rates by county. And instead, we want incidence over here. So go ahead and click that. It might take a moment to update, but you can see that it started to show everything. And while we're in the cheese stack, the layers again, I am going to take off the health systems, which are all these dots right here showing everything, which is likely how your CRC data dashboard showed up. But again, you can just hover over that eyeball and go ahead and turn it off, and they've disappeared. So over here, again, we're looking at the legend. We have incidence rates by county. You can see that the lighter colors, pretty much across all factors that you look at in the dashboard, are the ones that will be the lowest levels, the lowest rates. And then over here, like we said, we've got mortality rates. If we go to that legend, and we haven't taken off those cancer centers, so we go over here and click on those layers and take off that health system. So you see that I and cancel it out. So now we're set. We've got like kind of what we want to look at regarding that first question, incidence and mortality in a state. And I live in Illinois and I've tested it out a little bit with Illinois. So I'm going to show you all that one and then go to someone else for a different state. So we're going to go ahead and click that state specifically, which is up in the corner. You can click by state and go ahead and scroll to Illinois. Illinois is a good example because it's one of the, I think it's the fifth largest state by population, so a lot of data there. And it'll zoom in automatically and show you that state, whichever one you're looking at, including your own if you chose a different state. So again, we can see the lighter variation in color is always the lower incidence or lower mortality. And as it's loading, we can see what's great about those bottom parts that Leora showed was that we have mortality down here, we have incidence down here, and then over on this side, same thing, mortality, incidence, screening, and we'll get to screening in a moment. But as we're looking at these questions, I just want to point out that what is really easy to answer that first question in what we have is looking at the highest CRC incidence. So we can go over to incidence and we can see this national rate here, but then we can click the one that has the highest incidence. And as we click on that, it'll zoom in. And this again, incidence over here, mortality over here. And this is suppressed probably because there's so few people that live there. So maybe we want to look instead by zooming back out at mortality. And then we'll get to those clinics and health systems there as well. So it's reloading, taking that moment, and we'll zoom in on the one that has the highest mortality. And in this case, it's Richland County. And when you start to look at the map, you can start to zoom out a little bit, but you can see already that there is some major problems with mortality in the area. So we'll zoom out one last time. So now we know where Richland County is, and we know it has the highest mortality. And as we look at Illinois itself, zooming in a little bit, uh, we can see that there are some things just by looking that you're like, look at that rate that's coming through over here. And similarly over here. And if we look again and add some layers to this, add them back in, we can look at health systems. So maybe we want to see hospitals, maybe we want to see federally qualified health centers, and then we can take off, we can show those on the map itself. And we'll do that on both maps. So they match those cheese slices and make sure we've got all three showing. Little eyeball. And we can see again, we see that kind of like roundabout here, and here is that county, Richland, and here it is again over here. We can start to zoom in just a little bit, and there are no hospitals or cancer centers or FQHCs close by that area where all of the CRC mortality is happening. So that might be something that you want to explore more. You can also look at an individual FQHC if you'd like to start to partner with them, whether that's in Richland County, Olney Health Center, or thinking about the next nearest hospital and starting to engage them, which is St. Anthony's Memorial Hospital. And for me personally, I live in Illinois, so I know that like that's a very rural area. And that is something that I would probably use the ACS NCCRT's new rural toolkit and guidebook to potentially address some of the barriers I might find. But I also need to just assess where these things are happening. And I know we've probably gotten a couple comments in the chat of who would like what state we should go to next to kind of look at some of this data. And so let me pull up the chat. Do we have a shout out of a specific state that we should look at? I see I see Disa mentioned Wisconsin, but which we could. Disa lives in Wisconsin. Um, but let's choose a different state. If anybody would like a specific state to look at, go ahead and shout that out in the chat. But looks like North Carolina, which wins because that's it's one that popped up in there. So it's resetting right now, and I'll actually go to the second dashboard that I have open just so that I can move on with you all. So again, this is set up the same way we did before, where over here we have incidence, over here we have mortality, and then we'll go into North Carolina. We'll go a little bit faster this time. We'll choose that. It'll zoom in North Carolina, and we can start to look at what's going on in some of these areas. So it's starting to load and show us what's going on. And again, we're starting to look at the area we're seeing a little bit darker up here, and we're also seeing some darker mortality as well. So maybe we want to look at those individual health centers just to get a start at like, are people able to access screening? How accessible just generally is that screening? And so again, we can show those on the map, and we're seeing that there's no FQHCs listed in this specific layer of data, which is interesting. I don't know if there is an issue with FQHCs. Oh, and then they showed up. And there they are. And so taking that moment to allow them to load as well. But those things you're starting to see maybe a little less hospital access there. No cancer centers available either in that area. So they're all over to another side of the state. So maybe there's something that you can do to encourage cancer centers to expand their outreach in this area of North Carolina. And really, that is something that you can start to explore. So I do see a question about from Allison about timing and stage of diagnosis, and there is something in there. But first, I just want to show you screening, how you look at that as well. And then hopefully we'll have just a tiny bit of time to look at some special populations, just so that you can get a feel of what you can access in here. So I'm going to go ahead and take those health systems off of this one. And I'm going to, instead of using incidence rates, I'm going to take that off. And I'm going to look in, I believe this is where you can find. There is something in here I know about late stage. Is it here? You can always explore this yourself as you're like going through and thinking, what do I want to look at? Here we go, late stage. So, in the case of looking at this is an even more finite map where you can see down to likely the zip code or census level. And you can see again in this area where there's a lot of CRC mortality, there are pockets even within here where you can see that there are issues in this specific two county area or one county area where late stage diagnosis is quite prevalent. Again, because the darker shows the prevalence. So that's something that's available to you as you'd like to look. Maybe you do want to look at late stage specifically. Um, and I will show screening as well, just as we're about to run out of a little bit of time. But we do want to show screening, like I said. So instead of that late stage, we're going to show the screening specifically. So it's going to change and reload, and you can see that again, the screening. In this case, we would look at the legend to make sure that again, the higher rate is dark. So in this case, you're kind of looking at the ones that have lighter. And there is a little bit of it's interesting because it has a high rate of colorectal cancer screening, and to whoever suggested North Carolina, you are the one who would have the information about that specific state and who's living there, whether it's like a high population of elderly or something like that, where whatever it might be that you, or maybe it has a high population of African Americans or Native Americans who have a very high rate of CRC mortality and incidence, which we saw in our first session of this learning community. And so there's so much more that we could explore. And I know I'm seeing some extra things in the chat, and I know we're running up at the end of time. So what I will encourage you to do as you go forward is to explore the CRC data dashboard. And I'll ask Disa to bring up the extra slides so that we can wrap up everything. But just know that some of these, yes, population characteristics are available in the CRC data dashboard, and I won't have time to show those, but there are census demographics where you can go in and look at poverty, you can look at educational attainment, age groups. There's all different kinds of things that you can start to compare these maps one to the other. And that's our call to action, that you go into the CRC data dashboard, which we've shared how you can use it with partners, and then some of the capabilities. And there's so much that you could look at regarding those demographics, insurance status, those kind of things, and really assess. Maybe it's just bare minimum. Assess the CRC incidence and mortality in your state. Maybe you're just looking at screening, which was the bare minimum that we did here. And then we started to get all these extra questions that we can answer in the CRC data dashboard. So we really encourage you to start to explore, see how you can tailor your messaging to specific groups, maybe engage partners in those groups if you're seeing a really high rate of mortality in a certain area, you want to reach out to a specific group or just to that county. It's really your ability to do that with this information. So we'll finish up with just a last poll. Hopefully you're feeling good about what we learned today. There's so much more you could do with this, I know. But go ahead and take that poll. There are 8 questions. So go ahead and scroll through that and make sure you answer all 8. And we'll give you just a moment of some music, if possible, to take this presentation or take this poll before we have some final resources to share with you and final follow-up. So we'll give a moment of that music. All right, so starting to come back for these last follow-ups. Feel free to finish up that poll and submit. Make sure to click submit so we have that data to follow up on and know how we did on this session. But data resources, Liddy will be dropping them in the chat. We have the CRC data dashboard, which I encourage you to start to move around. Maybe watch the rest of that tutorial, which is another 3 or so minutes. We also have, I mentioned, the Increasing CRC Screening in Rural Communities practical guidebook that just came out. We would love for you to use that if you're seeing a lot of issues regarding rural areas in your state or community that are struggling with screening. And then finally, there's a set of CRC or just general cancer data resources that Liddy will also share in the chat. So yes, we're on our roadmap. We're moving forward. We have one last session left. So just wanted to mention that we're going to hopefully hear from some state cancer planners and making sure that they're talking about what they've done regarding CRC mortality. And that'll be on September 4th. So make sure to join us at that time if you're already on the call, but hope you can join us for that next one. And then I believe we have one last slide, and that's our Cancer Coalition series. And these are our webinar topics that we've had over the past year. Feel free to read through those, access them on our ACS for CCC website. Last slide, I believe, is just, yes, our ACS for CCC website. So go ahead and visit that, get to those webinars, watch those recordings, maybe ACS Coalition University as well. But really, thank you all for joining. I'm sure we could spend hours working on this data dashboard. So, really appreciate you joining. Hopefully, you got something from this, and we will see you on September 4th.